Now let's look at pervasive developmental disorders, which are characterized by difficulties with language, as well as the failure to acquire social skills or the early loss of social skills. The first is autism spectrum disorder. Autism is actually seen as a spectrum of severity ranging from the mild to the severe. And autism refers to severe language impairment and poor social interactions. Usually, autistic children, which are more often males, tend to focus on objects rather than people. And these children often show repetitive behavior like flapping their arms or hands and have below normal intelligence. It's only in rare situations that these children will have unusual abilities, like the savant in the movie Rain Man, played by Dustin Hoffman, who could do huge math calculations in his head quickly. Those are actually pretty rare. The most effective treatments for autism have been behavioral and supportive therapy to improve their communication and social skills. Now, milder forms of autism present with repetitive behaviors, difficulty with social skills, and obsessions with certain interests, weird interests sometimes, like memorizing the prices of Lego bricks on eBay. These kids usually have normal intelligence without any verbal language or cognitive deficits. If any of you have seen the movie My Name is Khan, where Shah Rukh Khan plays the role of a man with mild autism who takes a long journey to meet the President of the United States and tell him that he is not a terrorist. And doing something like this would probably not be possible for a patient with more severe autism. Now, if you haven't seen Rain Man or My Name is Khan and you have no idea what I'm talking about, go watch a quick preview on YouTube of these two movies and you'll get a good picture of the spectrum of autism. Alright, next we have Rett disorder, which is a dominant X-linked disorder seen almost exclusively in girls. Why is that? Because males die in utero. Most cases are caused by a mutation on the MECP2 gene, which is on the X chromosome, and that's why it's X-linked. If you want, you can go back and review a more complete list of X-linked disorders in the biochemistry chapter. MECP2 stands for methyl CpG binding protein 2. Now, if you realize that MECP proteins play a role in gene suppression in nerve cells, then it becomes easier to understand how this disorder develops. So, it plays a role in gene suppression in nerve cells. Symptoms of Rett disorder usually include regression in mental abilities and developmental abilities, and they start at the age of 1 to 4. So, in addition to the loss of developmental and verbal abilities, there is also mental retardation, ataxia, and a stereotypical hand-wringing behavior. In contrast to autism, this disease involves a loss of development as opposed to an initial failure to develop, which is the case in autism. Now let's look at the patterns of neurotransmitter changes with disease. The reason it's important to know this is that because many of the medications aimed at treating these diseases will attempt to push the neurotransmitter levels back towards normal. So let's first look at norepinephrine, which, as we know, is a stimulant. So it's increased in anxiety and decreased in depression. So that makes sense with norepinephrine being known as a stimulant neurotransmitter. Dopamine is also a stimulant, and it's increased in schizophrenia and decreased in Parkinson's and depression, which makes sense because generally you find people with depression and especially with Parkinson's moving slower, whereas people with schizophrenia some types of schizophrenia tend to be overstimulated. Serotonin, also known as 5-HT, is decreased in anxiety and depression. Acetylcholine is decreased in Alzheimer's, Huntington's, and during REM sleep. And gamma aminobutyric acid, is decreased in anxiety and Huntington's disease. Let's look at orientation now for a bit. This refers to a patient's ability to know who they are, what time or day it is, and what their circumstances are or where they are. So, what are the common causes of loss of orientation? They include alcohol, drugs, fluid or electrolyte imbalances, head trauma, hypoglycemia, and nutritional deficiencies. Now, usually when people lose their sense of orientation, they first lose their sense of time. Then, this is followed by a loss of place, like location or situation. And finally, they lose their loss of self, their loss of their identity or person. If they are oriented with respect to all three, though, we often refer to them as AO times 3, alert and oriented times 3. Okay, flash quiz. Depression is associated with a decrease in which three neurotransmitters? Answer is norepinephrine, dopamine, and serotonin. So norepinephrine, dopamine, stimulant neurotransmitters. Serotonin, usually thought of as a happiness neurotransmitter. And so you would expect these to be decreased in depression, where people are depressed, they're not happy, and they're usually not very stimulated, so they have kind of slow, very sluggish movements. Let's look now at the two types of amnesias. There's two directions that amnesia can occur. First is retrograde amnesia, in which people lose the ability to remember old memories that occurred before an insult to the central nervous system. In contrast, anterograde amnesia is where people cannot form, what kind of memories do you think? New memories. And these would be new memories of events that occur after a CNS insult. Now, Korsakoff amnesia is actually a classic anterograde amnesia, but potentially some retrograde as well. And it's caused by what? A thiamine deficiency, or also known as vitamin B1, and this leads to the classic bilateral destruction of the mammillary bodies, which are on the ventral surface of the diencephalon. Classically, it's found in alcoholics and is associated with confabulations. And this is in contrast to Wernicke's encephalopathy, which previously was mentioned in the biochemistry lecture. And this is also caused by thiamine deficiency, but manifests with more oculomotor anomalies such as nystagmus, anisocoria, ophthalmoplegia, and sluggish pupil response. Now we have also dissociative amnesia, which refers to an inability to recall important personal information, usually following trauma or stress. This is similar to dissociation, one of the immature defense mechanisms mentioned earlier, but differs in that it includes memory loss. It may also be accompanied by dissociative fugue, where the patient travels or wanders around during a period of dissociative amnesia. Classically, dissociative fugues happen when you have natural disasters or wars where individuals lose the ability to remember details about themselves. A good example would be a Hurricane Katrina victim who fails to remember details about their childhood and individuals from their upbringing, like their parents. The word fugue in psychiatry refers to a short-term, reversible amnesia. So when the patient's normal memory returns, they don't remember what happened during the fugue. Cognitive disorder is an umbrella term that encompasses delirium and dementia. And we'll talk about both of these in a moment, but they refer to any general change in cognition, including memory, attention, language, or judgment. And this change has to be compared to a previous level of functioning. It's often seen in the setting of CNS disorders, general medical conditions, medications, or substance abuse. Delirium and dementia are very boards and clinically relevant topics. So, what is delirium? Delirium refers to a waxing and waning level of consciousness with acute onset. So, delirium equals changes in sensorium. This means there can be hallucinations and illusions, disturbances in the sleep-wake cycle, and cognitive dysfunction. This is an incredibly common illness in the hospital setting, as patients with CNS disease, infection, trauma, substance abuse or withdrawal, metabolic or electrolyte disturbances, hemorrhage, or urinary or fecal retention, or people taking anticholinergic drugs can experience delirium and the hallucinations, illusions, sleep-wake cycle disturbances, and cognitive dysfunction that go with it. Some of the hallucinations or illusions include a sense that bugs are crawling over your skin, and this is called formication. Since it can occur as a side effect of drugs like anticholinergic drugs, it's always important to look for the underlying cause before you pull out the antipsychotics and benzodiazepines and start giving someone drugs. Another important point is that delirium, unlike dementia, produces abnormal EEG readings, although you wouldn't normally check that on a medical or surgical floor. On the exam and on the wards, be on the lookout for patients that have a wandering attention even while the doctor is speaking to them. This is a good sign that the patient may be in delirium. Treatment for the patient includes addressing the underlying cause and fixing that, optimizing brain oxygen and hydration, and treatment with antipsychotics such as haloperidol.